There's a sign-up sheet for 283, HB 283. If any of you here for HB 481, it has been pulled and will not be on the calendar. All right, I'm going to call us to order. Clerk, if you'll call the roll.
Senator Butler. Here. Senator Cornley. Here. Senator Chasteen. Here. Senator Coleman. Senator Figures. Senator Devan. Senator Hatcher. Senator Hovey. Senator Kelly. Here. Senator Melson. Senator Roberts. Senator Sessions. Senator Weaver. Senator Bell.
Here. All right, first bill, SB 285, Senator Stutts.
Thank you, Mr. Chairman, members of the committee. I appreciate you taking time to have this bill on committee today and just talk about a few of the issues. You know, we all agree that we've got some crises with healthcare providers, with hospitals, particularly in rural areas across the state, and but even in urban areas, hospitals are struggling to make ends meet. The entire healthcare reimbursement situation in the state is not good, and so as a practicing physician for 32 years, I've seen this firsthand, and I've looked at what we can do to streamline the process, make the process more efficient. You know, if we look at the number one problems of healthcare provision, it's reimbursement across the state. I mean, Alabama ranks at or near the bottom in any category of where you calculate healthcare reimbursement, and that is a problem that the CON law that this bill doesn't address, but that's something that as a body here we have to look at in the future. If you just look at the CON process in general, I'm a pretty simple person of analyzing where things come from and where they go. And there's only one way that dollars come into the healthcare system, and that's by taking care of patients. And when we have anything that takes dollars out of the healthcare system that doesn't contribute to healthcare, I think that's a detriment to the system. Hence the PBM law that we looked at earlier in the session and passed. The CON law falls in that same category. They're an unnecessary middleman controlling healthcare providers, and they don't provide any healthcare. And they take millions of dollars a year out of the healthcare system in the state of Alabama. Local hospital in my area was wanting to add some psychiatric beds to their hospital. They already have a psychiatric unit, and the CEO there told me that they spent 2 years and over $200,000 in legal fees negotiating the CON process to add, I can't remember if it was 5 or 7 beds to their psych unit, and they had no opposition. No other hospital, nobody else in the area opposed them, but they spent $200,000 on legal fees just navigating the CON process. And so my point is, last year I introduced a bill. I know what we're up against. I'm a realist of fighting this, but I want people to think about it and want to address the issue. Last year I introduced a bill to repeal the CON requirements for hospitals in rural counties. We talk about rural health care all the time. Well, let's get out of the way of rural health care. If somebody has some innovative things they want to do, can offer a service, let's get out of the way and let them do it. We weren't able to go anywhere with that bill. This year I looked at what are the top 2 things in the state that we would say services that are lacking in the healthcare community, and it's obstetric services and psychiatric services. If you talk to any hospital administrator that you know, will say what urology is also on that list probably, but the top two are going to be obstetrics and psychiatric services. So that's why I filed this bill to say if somebody wants to offer obstetric services, if they can, you know, I understand there's obstacles to that. If they need psych beds in their hospital, in their area, we need to get out of the way and let them do it. We could have already had those new psych beds in our service area where I worked 2 years ago if it hadn't been for the CON process. And they're finally got approved and finally getting started on them, but it's taken over 2 years. So anyway, that's the genesis of this bill. Let me give you, and I won't take much of your time, I want to give you just a brief history of the CON and why I'm saying the things about I am. It started after World War II. In 1946, the Hill-Burton Act was passed to encourage the development of rural hospitals, and we've got hospitals around the state that were Hill-Burton hospitals. To receive funding for these, the states were required to implement health policy planning programs. So that was the federal strings that were attached to the Hill-Burton Act. Prior to this, only 5 states had health policy planning programs. 1972, Section 1122 of the Social Security Act required states to review capital expenditures, bed capacity changes, or substantial changes in services. Compliance with this in 1972 was encouraged by loss of Medicare and Medicaid funding if one did not comply. 1974, National Health Planning Resource Development Act was designed to develop national health planning policy to support cost containment efforts. And this resulted in a majority of the states repealing Section 1122 review and replacing it with CON laws. So that's where the CON laws got started in most states, was in about 1974. The 1980s, the National Health Planning and Resource Development Act of 1974 was repealed because it failed to reduce health care costs and was having a detrimental effect on local communities. So what I'm saying there is the genesis of the CON laws in most states was this bill from 1974, and in the 1980s the federal government repealed that because they realized it was not working. It was not controlling costs, and it was having a detrimental effect on communities. So my point is, and I won't belabor it, I could talk about it a long time, but if you look at just some of the data, I'll hit just a couple of points. States with CON laws have 30% fewer rural hospitals per capita than states that don't have CON laws. CON does not protect rural hospitals. The reason for CON laws no longer exists. At one point, hospitals were reimbursed, as we talked about with these acts, and they were reimbursed with a cost-plus formula. That no longer exists. Since the 1980s, that's not the case. So they don't serve the purpose they were originally set up to do. And Alabama is one of 8 states with the most restrictive CON laws across 6 broad categories. And so we're one of the most restrictive states in the country as far as the CON law is concerned. So my point is, in closing, I want to get us talking about it by filing this bill. I have had a couple of different interested parties say, let's sit down and talk about this during the off season and see if we can come up with some model legislation for next year. And we plan to do that. And Mr. Chairman, I appreciate you letting me speak at your meeting today, knowing the bill's not going anywhere. Because I fully understood that when I filed the bill, but I want to, every year, I want to make us have to talk about this issue because it's a detriment to the free market, it's a detriment to healthcare services, and we spend millions and millions of dollars on rural health care, incentivizing people to go to rural areas, and My point is, if we want them to go there, let's make it easier for them to go there. Let's get out of the way of them going there. If we want them to go there, let's quit paying them less when they do go there. And those are the fundamental things that we need to look at and fix. And I appreciate the indulgence of the committee of listening and said, I want to get the issue out there for discussion. And like I said, I know we're out of time, and I knew when I filed the bill with plenty of time, it was not going to go anywhere because I knew who was against it. But I wanted to make us talk about it.
And
I appreciate y'all listening.
you, because I know we were going to have a public hearing, but I think you engaging with some of the parties involved in it, the public hearing was pulled, and we're going to carry the bill over so that maybe next year y'all can work on a product and bring it back to us.
Absolutely.
And thank you, Senator Stutts.
Thank you.
Thank you. All right, next will be HB 283, Representative Shaw, and after you come up and talk about the bill, we're going to have a quick public hearing.
All right, well, thank you, Mr. Chair. Thank you, members of the committee. This is HB 283, the Alabama Personal Data Protection Act. I won't go into stories about the growth of data and how much of it there is. I mean, everybody knows that there's data is prevalent, it's growing every day, and a lot of it belongs to us. It's tied to us. It's personally identifiable information about us. I have lived for 30 years in a data environment where we are regulated based on personally identifiable data. Unfortunately, the federal government has not acted when it comes to privacy and our rights over our data. So as a result, states have been forming their own data privacy laws. To date, 19 states have passed it. We're under about a third, getting close to half of the population of the United States is covered by a state data privacy law. So what this law is a 30-page bill, simple bill, as we say, and it's destined to become one of the greatest hits in the House because it was actually read on the floor because people were so interested in it, obviously. But what it goes, it kind of sets up a bunch of definitions. It says what businesses are covered, what businesses are not covered. In general, if you are already regulated, we do not want to come in and re-regulate something that you're already handling under another body of legislation. So, and as somebody who's lived in that world, there's nothing more frustrating than multiple regulatory environments covering conflicting rules and all that stuff. So we don't want to do that. And then it talks about what those businesses must do, how they must treat your data, how they need to notify individuals about the rules governing their data. And then it talks about their rights. In data, we call it CRUD, create, update, delete records. And in general, that's what it's about, is like your rights about that data with the people that are controlling it. And it's enforced by the AG. The AG, if somebody's not treating your data right, they can enforce it. If they don't, they can let them know. If they don't correct it, then they are subject to a $10,000 fine if they don't correct the data. So we've had a lot of great discussion about it. I know, Mr. Chair, this is a public hearing coming up. I think we've kind of run out of time on this one too. A lot more people that were interested in this than we thought would be. I received no less than 16 full red line write-ups from different organizations saying, hey, this is what you got to do with this bill. And we worked really hard for a few months to try to incorporate all those suggestions because it's really important and it can affect a lot of businesses. We took out a lot of the red tape from other bills that we saw, made it very simple for businesses to comply, made it very simple for consumers to try to exercise their rights. So we got a lot of work done, but we didn't quite get there. So I appreciate your consideration of putting it on the agenda to discuss.
All right. Senator Roberts.
Representative Shaw, thank you. You have worked countless hours on this, trying to pull this together. You talk about things I've never thought about, heard about. I mean, you know it's out there. We all know our stuff's everywhere. And but thank you. And good luck as you seek to ferret this out, sir.
Thank you, Senator. All right.
Mr. Baker. 2 minutes. You'll have 2 minutes. If you go over the 2 minutes, I can't tell you what happens.
I probably won't take that long, but I appreciate it, Chairman. I'm Ben Baker with the Alabama Association of Justice, and we oppose the bill in its current form. But I have to say the representative, we spent a lot of time talking about it. He has been great to work with, and I hope we get to work with him in the off-season to try to straighten out some of the issues we see with it. Primarily what he and I have talked about is our concern is we don't believe the consumer protections are in there and have actually been removed. And there's no real way to enforce some of the requirements that are put on businesses in the current bill. For example, there's 2 places in the bill where it lists out things that businesses are supposed to do to protect the data. And then as it gets to the end, it says that they have to publicly commit to do these things in the bill. Well, publicly commit doesn't mean they're going to do it, and we think it ought to be more stringent. The representative and I have talked about some examples for Florida. They have a stronger bill with the AG able to come in and regulate it. We also have a bill on the books called the Alabama Genetic Data Privacy Act. It also has some stronger criteria in it. It allows the AG to come in, actually enforce it, and require a company who might injure somebody whose data has been released to be compensated for whatever that damage is. We believe what's at the end of this bill actually takes those rights away from consumers in violation of the Section 11 and 13 of our Constitution. So it's really about the regulation and the consumers having the ability to pull the AG in and address some of their concerns, which we just don't think is in the bill right now.
Okay, thank you, and you were under your time.
Thank you.
All right, Representative Shaw, thank you. I know you've worked hard on this, got a lot of hours in it. I hate we've got to carry it over, but good luck in the off-season, and hope to see you back next year. All right, thank you. With that committee, we are finished.
Thank you, Senator.